The answer to this question actually depends on the extent of the cavity. The size and the depth of the dental cavity is actually a very important factor, as well as your risk of getting dental cavities and how you take care of your teeth. Remember the layers of the tooth crown. You have the outermost covering called the enamel, which is protective in function, the second softer layer called the dentine, and the middle portion called the pulp, which contains the blood vessels and the nerves. If you have a small cavity limited to just the enamel, you may not need to have a filling placed. This is especially true if you've had very few cavities in the past and if you also practice good oral hygiene. But whether your cavity fits into the description will have to be determined by the dentist. Now, for very small cavities that are limited to just the enamel, this is the process we call decalcification. These can actually be reversed by good oral hygiene practices. That means brushing and flossing properly, especially with a fluoride containing toothpaste. The fluoride that is present in the toothpaste actually helps to remineralize the enamel, thereby reversing the decay process. Your dentist will actually have to be the one to determine if this cavity that you have is small enough to watch and if it has the potential to be remineralized. Now, if these small cavities that are limited to the enamel are not taken care of or watched properly, they can eventually get worse. They can expand or spread, and then they go from the enamel, affect the dentine, and then if care is not taken, it goes all the way down to the pulp. And remember that the pulp contains the nerves and the blood vessels. This will result in discomfort ranging from sensitivity all the way down to pain. In worse situations, it can actually progress to cause an abscess, resulting in a gum or jaw swelling. That being said, not every cavity can be watched over time. Some cavities actually require immediate treatment to prevent them from getting worse. Generally, if a cavity has gone past the enamel, you may come down with some sensitivity or some mild discomfort, and this can actually be a trigger that makes you go to visit the dentist. But this does not hold true for all cases. Some people can actually have very bad dental decay with even pulp involvement, but they don't have the corresponding symptoms to match it. I have actually experienced cases whereby a tooth is completely dead, the nerves are affected, there is presence of abscess with gum or jaw swelling, and the patient does not have the corresponding symptoms. Now, this brings me to my point that even if it doesn't hurt, it doesn't mean it shouldn't be treated. Now, if you have a small cavity, you will need to definitely visit your dentist so that he or she can identify if the cavity is limited to just the enamel. And if it is, there is a possibility that it can actually be remineralized, thereby reversing the decay process. What you have to do is make sure that you brush properly. So you brush about 2 minutes each in the morning and at night. You floss daily also. Remember to use a fluoride containing toothpaste because fluoride has been proven to actually help in remineralizing the tooth and reversing tooth decay. As an addition to your routine, you may want to also use a fluoride containing mouth rinse. Now, regardless of the fact that you're actually following good oral hygiene practices, make sure to visit your dentist as routinely as possible for dental cleaning and checkups so that they can look out for any signs if the cavity is getting bigger, signs like sensitivity or discomfort. But if you have a big enough cavity, regardless of whether you're having pain or not, please make sure that you visit your dentist. I've actually had patients who never knew they had dental cavities, and then when they present to the dental clinic, they find out that they have cavities on virtually all their molars. It can be a very surprising moment for them because most times they think that they're doing a good job by brushing and flossing properly. When it comes to dental issues, it's always better to aim at prevention than treatment. Now, if you're lucky enough to know that you have a dental cavity or you went for a regular dental checkup and they spotted a cavity, please make sure that you take the advice the dentist gives you. It is easier to fill a cavity when it is smaller, and it is easier for a filling to last when it is smaller. The bigger the dental cavity, the bigger the filling. And once you have a big filling placed, there's always that issue with retention. You don't know how long that filling can last, and that's why we'll talk about placing dental crowns as a protective covering. And dental crowns cost money. If you're able to take care of a cavity when it is small, it's going to save you a lot of stress and a lot of money in the long run. So regardless of whether there is pain or not, please make sure that you do something about your dental cavities. Now, in some severe situations where you already have pulp involvement and abscess, of course, cavities like that can no longer be filled. If that tooth is a good candidate for a root canal treatment, it definitely will be recommended to you by your dentist. But if not, most likely to need to be extracted. And once it is extracted, you have to place a prosthesis, maybe a denture, a bridge, or an implant. So you see why we say early treatment is better. Early presentation is better. Regular dental checkup helps to checkmate all these things on time before they get worse. So that being said, I hope this video has helped you in one way or the other. Please subscribe, like, and share this with someone, and I'll see you in the next one.